So you make a doctor's appointment. Sometimes you're running late, and by the time you're there and you see the doctor, you're in a rush, and you leave without those important questions being answered. So this morning we are talking about the patient being prepared ahead of time with some important questions so that they can build a good relationship with their physician and get the best care possible. Dr. Paul Griner wrote a book about it, and he is here to share some of his important tips, and you see it there, The Power of Patient Stories. Doctor, good to see you. How are you?
My pleasure, Logan. Very good. Thank you.
So tell us what patients should do before they get to the doctor's office so they can prepare.
Well, the time is short, so the patient needs to understand their symptoms, be precise, list their symptoms mentally if they might want to take even a small paper, write down some of these symptoms. When they go to the doctor's office, they also need to know what they want the doctor to tell them after he or she has indicated what the nature of the problem is. Let's say this is a newly established diagnosis of hypertension.
Okay.
Doctor, what does this mean for me? Do I have to change anything? Is my work going to be influenced? Will I be able to continue to work on my hobbies? What can I do? What can I do to influence this, to make it better? Weight loss, for example, exercise, relaxation techniques, all these kinds of things would reduce the need for medication, for example. And finally, where can I learn more about this illness? Because it's me, and I want to stay healthy, and I want to know as much as possible.
Now with WebMD and Google and so many other sites, is it a good idea for a patient to go on these various websites and try to figure out maybe what their medical problem is so that they can go to the doctor and have that information? Or does that then maybe steer them in the wrong direction?
Yes and no.
Okay.
You have to be careful in going to the proper set of websites. For example, the most scientific and accurate are the ones that you might expect. www.mayoclinic.com. Same thing for Johns Hopkins. The Harvard Newsletter. All of these are superb information resources. You want to try, and the NIH is another, of course. You want to stay away from anecdotal, individual responses on Google, because in some cases they may be quite accurate, and others they'll move you in the wrong direction.
How long should a typical doctor's visit take?
Good question. As long as it takes to get the job done. So in some cases, a 10-minute visit will be more than sufficient. That's a routine visit to check blood pressure and a few other laboratory tests. In other cases, a patient, for example, with rheumatoid arthritis, very active problem, might take 30 to 40 minutes. Yeah. So it varies. It should vary according to the patient, not the time clock.
I know sometimes I have felt like I get into that room, and then the doctor comes in, and they've got 2 minutes, 3 minutes with me, and if I don't get my questions asked and answered in that moment, he's gone. Because, you know, in today's day and age, doctors are busy. They've got a lot of patients, and with Medicare and Medicaid, they've got to kind of get you in and out in order to make a living.
Yes, well, we need to move more toward team care, first of all, so that not everything has to be done by the physician himself or herself. The patient should be empowered. The patient needs to take control of his or her health, insist on being heard. And if you have a disappointing visit or repeated disappointing visits, I've always said, go home, write a letter to your doctor, sleep on it, then write it, then read it, and send it off. Surprisingly often, the physician will read a letter like this and gain insights that he or she didn't have. And in fact, the best response would be, Mrs. Jones, please come back to the office. Let's talk about this. I'm sorry that you've been disappointed.
All right, Dr. Paul Griner, thanks for coming on the program. One more time, the book, and you can get it Amazon.com, bookstores, things like that?
And drgriner.com, drpaulgriner.com.
Terrific. Thank you, Doctor. Appreciate
My pleasure.
That. Still ahead, the doctor's office to the classroom.